According to the World Health Organization, 358,000 women died during pregnancy or childbirth in 2008, 87% of these cases occurring in poor countries in sub-Saharan Africa and South Asia. Among the countries with the highest rates of maternal mortality, Nepal experienced over 280 deaths per 100,000 live births in 2008, accounting for 11% of all deaths among women of reproductive age. While lack of access to quality and affordable healthcare are a problem for many people living in developing countries across the globe, Nepal's extensive mountainous topography creates a further barrier limiting access to healthcare. Three ecological zones represent Nepal, including the Terai, or lowlands, the hills, and the mountain regions, with increasing difficulties in accessing health services with increasing distance from urban centers. Despite over $61 million of aid allocated to the healthcare sector per year and claims of improved rates of maternal mortality and child mortality, there was a large disparity in maternal care between rural and urban areas. While many organizations have reached out to both the Terai and the lower hills regions of Nepal, the mountain communities in the north and the far west of the country have been excluded from major infrastructural and educational initiatives. The primary purpose of the Rural Birthing Attendant Initiative is to increase the access to skilled birthing attendants in the mountain and far west regions of Nepal, using a comprehensive, multi-level approach. To this end, we started a pilot project in the Rasua district of Nepal and conducted a needs assessment. The Rasua district is ranked among the lowest 10 districts among the Human Development Index in Nepal. Here, the maternal mortality ratio is higher than the national average at 301 deaths per 100,000 live births. The majority of people living in the Rasua district mainly work in subsistence agriculture, and the women, who are primarily in charge of the agricultural duties, maintain arduous farming schedules throughout their life, including their pregnancy up until the time of labor. Information from the needs assessment suggests that women prefer to deliver at home with a family member or a traditional birthing attendant because it was easier, more affordable, and customary among community members. Reducing barriers to access of maternal health care services in the Rasua district would require strengthening the existing infrastructure and resources in the healthcare clinics by increasing staff capacity and motivation and improving outreach services in the community to the household level, including both women and their families. Working with the Mountain Fund, an organization that already has an existing relationship with the community, we will implement a 2-year pilot intervention with 4 components, including the addition of resources and equipment to the clinics, the training of rural birth attendants, community mobilization, and community education. The first step in this process to increasing access to maternal health services is ensuring that the clinics and the health posts are equipped with the staff, technology, and resources to support the rest of the educational components of the intervention. The second step is to address the lack of skilled birth attendants by improving access in the communities that are further away from the health post. We will implement a training program for traditional birth attendants to upgrade them to the status of maternal child health workers with a 21-week training program that would qualify them as skilled birthing attendants. Finally, we will use the community mobilization approach to apply a health education campaign addressing the attitudes and beliefs towards using a skilled birth attendant during pregnancy. This pilot project in the Rasua district would demonstrate that concentrating services locally and tailoring efforts to the needs of the community in each district is an effective approach to creating significant changes in the care-seeking behaviors among women and their families. Please support the Rural Birthing Assistant Initiative. Improving maternal health care is not just a privilege for those living in urban areas, but a human right to all women in all areas of the world, and providing access to life-saving services is the first step in making this goal a reality.